Good afternoon, everyone. Welcome to our campus health town hall. I'm Lori Clabo, Dean of the College of Nursing and Wayne State's Chief Health and Wellness Officer. Today, joining us are three of my colleagues from the Campus Health Committee. Dr. Ramona Benkert. Most of you know Dr. Benkert. She is the Associate Dean for Academic and Clinical Affairs in the College of Nursing, and she is a member of the board of the Nursing Practice Corporation, which operates the Campus Health Center. Dr. Benkert is also a practicing adult nurse practitioner. Dr. Paul Kilgore is an associate professor in the Department of Pharmacy Practice, an adjunct professor in the Department of Family Medicine and Public Health Sciences. He is an internal medicine physician and an epidemiologist by training. And Kelly Dormer. Kelly is a disability specialist in the Office of Student Disability Services. And I'm grateful to all of them for joining me today. And I'm grateful to all of you who submitted questions for us. We have lots of good questions for today. We'll just start. I'm going to give you a brief update on what's happening on campus. And the number of cases on campus has ticked up a little bit as we have seen the number of people on campus increase, but the number of cases remain low and considerably below any of the campus metrics of concern. The latest CDC guidance sees that our area is still considered an area of between substantial and high transmission, and for that reason, the CDC has suggested mask wearing indoors, and at Wayne State, we keep our indoor mask mandate through at least September 15th, at which time the Campus Health Committee will have a look at the data regionally, locally, and also by then have a really good handle on our vaccine uptake status on campus. Also want to make sure that people know that the new version of Warrior Safe Training is available on the Wayne State Coronavirus website. That's wayne.edu/coronavirus. And if you're interested in a quick update on the science undergirding our knowledge of coronavirus and the Delta variant, please feel free to invite yourself into the new Warrior Safe Training. Also a reminder to send your questions to healthcommittee@wayne.edu. We really enjoy answering your questions. We've been a little slow this week. If you haven't gotten a response very quickly, the return to campus has kept us all on our toes, and you will get answers to your questions very shortly. So let's just dig right in and get started. I'm going to ask Shannon, can I have Dr. Benkert? Ramona, lots of people have questions about what's happening, how are things changing for individuals who are vaccinated. So I'm going to start with a question that was submitted. What's the CDC recommendation or the university policy for vaccinated individuals who test positive for COVID-19? Do I need to quarantine? And if so, for how long?
Really good question. And thank you for bringing this up. I did want to say first, it's important to know that we do follow CDC's recommendations on all things, and that can evolve and change over time. But currently, for your question, I also want to add that the terms get confused. So if you are positive for COVID, whether that be a test or symptomatically, we would put you in what's called isolation. That's sort of protecting the person who's positive from others. And so you isolate them. People who are close contacts to that individual are quarantined. And so they're sort of they're quarantined away from the sick person and away from others so that they possibly don't spread the condition. So important to think about the terms differently. But to your question, would a person need to be isolated? Yes, they would. If you test positive or you're presumptively symptomatic until you get a positive test based on the symptoms you report to us, you would be in isolation, and you would be in isolation for 10 days, assuming you show improvement over time and you have no fever for the last 24 to 48 hours at the end of your symptom presence, or your testing. So as long as you stay fever-free and don't develop any new symptoms or worsening symptoms, it's a 10-day isolation.
And Dr. Benker, just help me out. I'm isolated on campus in housing. How often do I get to leave my room if I'm in isolation on campus?
Well, you don't get to leave your isolation room. Housing works very closely with the campus health center to move you to one of their special isolation rooms. You will move to that room, and then you will have food and other things delivered to you outside your door, but you are not allowed to leave your room during that 10-day period.
Another question, someone asked, how long does it take to exhibit symptoms if I've been exposed to COVID-19 and I develop the illness? How long does it take before people generally exhibit symptoms?
Good question. We call that the incubation period, and for the more common COVID virus that was here before Delta arrived or was mutated into Delta, it was a median time of about 5 to 6 days, with 6 days being the most common between when you were exposed to the person and you started to show symptoms or had a positive test. What we're discovering, as you know, as the science evolves, we're learning that the Delta variant has a shorter incubation period or onset of either testing or symptoms of about 4 days. So it's twice as likely to spread as the original virus, and so it's a slightly shorter incubation because of the massive distribution of the virus and more likelihood to get exposed and get contracted with the virus.
Thanks, Ramona. Shannon, can I have Dr. Kilgore for a few minutes? Hi, Paul.
Hi there. Good afternoon, everyone.
Good question that someone submitted. If I haven't knowingly been exposed to someone with COVID, but I have symptoms that might be allergies, might be a cold, but they're new, should I run out and get tested?
Yeah, this is a great question, and I'm glad they submitted it. You know, when we look at people that have COVID-19 and allergies, we think about a couple things first. One is, what symptoms are people experiencing? So typically seasonal allergies will exhibit symptoms including sneezing, coughing, runny nose, sometimes congestion, but typically without fever. So one quick thing that you can do if you're worried that you may have been inadvertently exposed and could be having COVID, early symptoms of COVID, check your temperature. And I recommend, if you can get a hold of a digital thermometer, that's a great way to check your temperature quickly. If you don't have a fever and you still have symptoms, and you may have had a history of seasonal allergies before, the next thing you might want to try is any kind of allergy medicine that you've used in the past that has worked. It could be an over-the-counter preparation, for example. If you feel that your symptoms are relieved by taking those medicines, then that's a good sign. It probably means that most of your symptoms or your symptoms there are really due to seasonal allergies. Now, having said all that, if you're worried that you may have had an exposure that you're not sure about, or you're out and about and you may have had someone near you who you think could have been exposed to another person, that's where I would err on the side of caution and just go out and get the test. It's easily available. It's at pharmacies and other clinics. Certainly Campus Health Center can run it. And you can get the result quickly and find out whether or not the test is positive or negative. So that's what I would do. I'd err on the side of caution. And just know one more thing. This coming year, we have influenza season coming up. And I'm going to put a plug in early now to say, please, everyone, make sure you go out and get your flu vaccine when the vaccine becomes available. And the reason for that is that this year, we're anticipating a potentially more severe season than we had last year, for sure. That means we could actually see a lot of people having symptoms of flu, and that can mimic symptoms of COVID-19. So the symptoms of COVID-19 that you're going to be watching for, things like headache, sore throat, I mentioned fever, runny nose, and a persistent cough. And especially if your cough gets worse and progressively worse, make sure you go in, talk with your healthcare provider, or go into the emergency department, and don't wait at home because we don't want you to get sick to the point where you need really advanced care.
And Dr. Kilgore, one thing I'll just mention, because I know students worry about the cost of things like testing and flu shots. And probably important for folks to know that for Wayne State faculty, staff, and students, testing at the Campus Health Center, flu shots at the Campus Health Center are of no cost to you, regardless of your insurance status.
Great point. Yeah.
So lots of talk lately about booster shots. And we were talking earlier about the fact that the science evolves and we're seeing new studies all the time that bring us new knowledge about the Delta variant, about immunity and the duration of the immunity. And I know you can talk a little bit about the evolution of science as it relates to SARS-CoV-2. But one of the questions people ask is the booster shots we're hearing about, are they different than the original shot? Are they different?
So this is a great question too. In answer to this, I'll answer very shortly and say the booster dose or the additional doses that we may be offered or may be available later this year are going to be identical really to the original vaccine that we got. Now, there's a couple of things people need to know. One is that the booster dose is really considered an additional dose after a primary series of the vaccine. And in this case, for COVID-19, the Pfizer Moderna vaccines are 2 doses each. The Johnson & Johnson is currently a 1-dose vaccine. So an additional dose for healthy people would be considered a booster dose. And that may be available later this year, depending on the CDC ACIP committee recommendations. They haven't weighed in yet on whether or not a booster dose is going to be recommended for the general population. So stay tuned on that. This is really an evolving story and it's evolving quickly. Now, for immunocompromised people, the additional dose we consider is a 3rd dose of a series, and you could call it a primary series. The reason this 3rd dose is so important for immunocompromised people is that we know from the data already that folks who are immunocompromised do not mount as strong an immune response as other people who are healthy and do not have immunocompromised systems. Now, if I may, Dean Kalibo, one of the things I'd like to mention is that for folks who are immunocompromised, the question is, well, who does that include? It includes folks like organ transplant people, bone marrow transplants, stem cell transplants, folks who have primary immunodeficiency, advanced or untreated HIV, and any folks that may be on high-dose corticosteroids, steroid therapy, very high-dose steroids. Those can suppress your immune system as well. So one of the things that we're waiting for now is additional information about the other vaccine recommendations with respect to immunocompromised patients. So that means we don't have a recommendation yet for the Moderna vaccine or the Johnson & Johnson. So stay tuned on that. That's another evolving part of our story.
Great. While I've got you here, I'm going to ask another question that's in your lane. Is it true that children are less likely to catch COVID-19 or to not get as sick as adults?
So this is a really great question because the answer is it depends on the age of the child. So we know children and adolescents can be infected with the virus. They can get sick with COVID-19 and they can spread the virus to other people. You know, in the United States, at least through March 2021, the cumulative rate of infections and symptomatic illness in children aged 5 to 17 was very similar to adults aged 18 to 49. And was also higher than rates in adults age 50 and older. So that means that children are definitely able to get infected and can be getting symptomatic disease. Now, one of the things that we know in younger children, I'm talking now about age 0 to 4, they're seeing rates of infection that are roughly half of those children that are age 5 to 17. So the youngest children are less likely to get infected, but they're comparable to infection rates in the oldest adults. So it's really kind of a mixed picture is the answer. And the bottom line is that when we think about protecting children, one of the things that we know is important is to reduce the exposure. And that means using the tools that we have available now for children that are recommended. And that means mask protection.
Great, thank you. While we're talking about children, when do we think that we might see vaccines available for younger kids?
So this is another great question. And the answer is it also depends on the age. One of the things that we know is we have data already from older children. So right now, kids age 12 and older have been eligible for the Pfizer vaccine since May. So if you have a child or you know of a child age 12 and older, they can actually go out and get the vaccine right now as we speak. The emergency use authorization for that age group, 12 to 15, has been approved because of the clinical trial data that we have showing that the vaccine is safe and effective in this age group. Now, for the younger children, and I'm talking now about 5 to 11 years of age, this age group has also been given the vaccine in a clinical trial setting. The vaccine data are being analyzed right now, and they have been submitted from Pfizer to the FDA. So the timeline that we're looking at for the approval of the Pfizer vaccine for the 5 to 11 years old age group is likely going to be sometime in the later part of this year, meaning October through December. Now, it takes a while for the FDA to review these data because it's a big pile of data coming from multiple trials. So it's been submitted. That's going to take 4 to 6 weeks to review. So that review will occur during September, October. And then keep in mind, the FDA advisory committee needs to meet after that, make a recommendation to the leadership of the FDA. And then from there, the EUA would be granted for that 5 to 11-year-old age group. Now, the youngest age group, and I'm talking here now about under 5 years of age, the studies have been done and are going on now for the age group 6 months to 5 years. Those data are also looking very promising. It looks to be currently safe and effective. We're waiting for the more final analysis. I expect that these data will be submitted to the FDA likely later this year in the fourth quarter. So the approval is likely to occur and with the review in the first quarter to first half of 2022. Not as quick as everyone wants for sure, but the FDA has limitations and they do a very, very thorough job in reviewing all the data very carefully so nothing gets missed.
Great. So while we're talking about timelines, you know, we heard a lot about people feeling more comfortable when the Pfizer vaccine received full FDA approval. And last time we talked about the difference between EUA and full approval. But any idea when the Moderna and J&J vaccines may receive full approval?
So the good news there is that for Moderna, they have submitted their packet, their application. And when I say packet, it's a huge stack of papers electronically. The FDA is reviewing that now. It was submitted at the end of August, so that's good news. For another several weeks, they're going to be reviewing it. Then the advisory committee will meet again to review all of that data for the Moderna vaccine. That's the adult series in younger children. When they review it, that's when they decide whether or not to give the full license. Now, the thing I would tell folks is that the vaccine that does get licensed ultimately is going to be identical to the vaccine that has been approved under the emergency use authorization. So in effect, you'll be getting the same vaccine. It's no different. So the formulation has not changed. That's good news too. Now for Johnson & Johnson, I'm expecting that's going to follow after the Moderna submission. So that means Johnson & Johnson will likely be submitting their packet for full licensure sometime in the fall. And that means likely in the late 2021, meaning November, December, possibly January 2022, we'll see a licensure application review by the committee for the Johnson & Johnson vaccine.
That's great. Thank you. We should give you a break for a minute. Shannon, can you bring up Kelly? So Kelly Dormer, our disability specialist. Kelly, we've got questions from students with disabilities saying, what about me? What's the university doing with students with disabilities in mind to make sure that they're safe on campus?
Yeah, so our staff and student disability services has been working hard to get students with disabilities support and figure out what accommodations we can provide to help them maintain their progress and stay involved here at the university despite their potential risks. So we know we have a number of students with chronic health conditions and other concerns that make them immunocompromised. and at higher risk for complications if they were to contract COVID. And we've been working with those students to identify virtual learning options and other appropriate accommodations. And we work really closely with all of the schools and colleges here on campus to, make sure that what we're providing is going to meet the students' needs and also meet the program requirements and just keep everybody on track. So students with disabilities should absolutely reach out and get registered with Student Disability Services for support and accommodation. If you're a student who's immunocompromised or has a documented health condition that concerns you, particularly as it relates to COVID exposure, or really any condition that impacts your ability to fully participate in the educational or campus experience, please reach out to us so that we can help get you connected. Our website is studentdisability.wayne.edu, and there's a button right on our homepage that you can fill a form out to get registered. And once our office receives that, we'll contact you within 2 business days to schedule an appointment with a disability specialist. Typically, students will leave that appointment with an accommodation plan, or at least a timeline to expect, how we're going to proceed to identify reasonable and appropriate accommodations. And if you have any questions about if your condition qualifies or what documentation you might need, please reach out to us either by phone or email, and our staff is more than happy to figure out how we can support you and get you the resources and support you need.
Thanks, Kelly. One of the questions I get asked is, what about students who have hearing impairment and the mask mandate? Can you talk a little bit about accommodations that we make for students?
Sure. So we've worked with some of our students with hearing impairments to figure out how to get them in online classes so that they can have their classes captioned. For a lot of students, that's an easier access option. For students who have to be on campus or choose to be on campus, we can provide real-time transcription where we set up a live stream. We work really well with CNIT to get the in-person class broadcast to a captioner who's similar to all of our town halls. A student would be able to watch on their computer to follow along. And we also have clear masks available that students with hearing impairments can pick up and provide to maybe other students they're working in a group with or their instructor, which helps improve their ability to lip read and just sort of read facial expression.
Thanks, Kelly. We're sure glad someone with your specialty is on our committee, keeping our eyes on students who have maybe some unique needs. Thanks again.
Thanks.
We'll bring you back in a minute. Dr. Benkert.
Hello.
People asking lots of questions about what should I do. So one of them is, with Delta variant spreading in our community, how safe is it to eat indoors with others?
Well, that's a really good question. I would say, since we are not, wanting individuals to have to ask each other if they're vaccinated or not, it's wise to not eat in close proximity to others if you don't know their vaccination status and leave your mask on. The other option is to do what we did back, earlier last year, is to eat very socially distanced. And when you aren't eating, put your mask on and communicate that way. But especially if you're indoors, it's really, given that we already said that the Delta variant is twice as likely to spread to another individual, it's best to use some distancing, especially since you don't know the vaccine status of your coworkers.
And it's a great opportunity to take advantage of these beautiful days in early fall in Michigan, to grab your lunch and take it outside.
That's true too.
And that leads to another question. Is it possible to catch coronavirus from someone else if we're outdoors?
It's much less likely, but it is still possible. As we keep saying, it's 2 times more transmissible. So being close to someone who maybe is coughing or has some clear potential for air, droplet dispersion is still a risk, but it is much better outside. And as you suggested, eating outside is the best thing because you have more better airflow and less likely for the virus to spread directly on you, but still some possibility.
Thank you. Dr. Kilgore, we gave you enough of a break. A question, what percentage of our population needs to be vaccinated for us to achieve what we keep hearing about as herd immunity?
This is a really great question, also very difficult to answer. And, you know, the reason actually is that it's a moving target. One of the reasons it's a moving target is that the Delta variant has a much higher transmission rate. What that means in practical terms is that if the Delta variant is circulating in your community, it can infect more people from every one person that's infected compared with the original strain. We call that the R naught. So right now, a lot of people are actually saying that it may be not possible to reach herd immunity. And the reason is that right now in the United States, we don't have a vaccination rate or level that is approaching what we think may be required, i.e. 80%, maybe even 90%, because the Delta variant is so easily spread. It's almost like a new disease, Dean Clabo, and a new disease compared with the original strain from early 2020. So it's very difficult to know what the herd immunity level will actually need to be, but it's going to have to be quite high. And that means if you haven't been vaccinated, or you know a friend or family member that hasn't been vaccinated, I would strongly urge them, and I'd be happy to talk with them and encourage them to reach out to us. And if they need any more information about the vaccine or getting the vaccine, we'd love to talk to them. It is the best way to prevent transmission and keep people healthy.
Thank you. Shannon, if we can keep Dr. Kilgore and maybe bring back both Kelly and Dr. Bankert. Question, I'm going to try this one. When will Wayne State be offering booster shots at the Campus Health Center? And will booster shots be required as part of the university mandate? So what I think we know is that we're waiting for further guidance on what we think of as the 8-month and later booster shot. And at the moment, we're waiting for advice from what Dr. Kilgore earlier referred to as the ACIP, the Advisory Committee on Immunization Practice. And we expect that we'll have further direction. Booster shots are available at Campus Health for those who are immunocompromised. And the question about will they be part of the university mandate? It's been a subject of discussion at Monday meetings recently. And currently, we don't see that we are anywhere near that status. The science on the booster shots is still evolving. And at the moment, we don't expect, certainly not for this fall, that we will change the requirement beyond what our current mandate status is. Anyone see a different perspective on that?
Mm.
All right, I'm gonna ask lots of questions about practice. Will the mask mandate be extended beyond September 15th? Answers, we don't know. We will follow the CDC guidance on where we are in terms of transmission status in our region, in the Detroit area specifically, and on campus, as well as finding out what our overall vaccine uptake on campus is. Kelly, somebody asked, lots of people walking around now on campus. Should I consider putting my mask back on outdoors?
So you're not required to wear a mask outside on campus unless there's a requirement put into place for a large-scale event, such as we had for Festival and New Student Convocation this week. And in those instances, that will be communicated widely so that you can be prepared. But I also think that I myself feel a little nervous with all of the new people on campus and being in close contact, and often am opting to wear my mask as I'm walking from building to building. And I think everybody should feel more than comfortable doing that if they'd like.
All right, I'm going to leave the most important question for last for Dr. Bankert. So if I'm a university staff member or student and I'm diagnosed with COVID-19, what's my first step campus related?
well, there's two first steps, but the very first step is to submit a Campus Daily Screener suggesting that you have been tested for COVID or you are worried about it based on symptomatology. And then while you're waiting for Campus Health to call you back, you need to notify your faculty or your supervisor that you are out ill and that you are concerned about this possibility, and that you will be staying home until you've talked to Campus Health Center and get some more advice. But always go directly to the Campus Daily Screener and fill out a screener. That's really our best way of reaching you, whether that be on the weekends, during the day. And just as a point of reference, Campus Health Center responds to Campus Daily Screener 7 days a week from 5 a.m. until 11 p.m. And then we pick up the people we missed after 11 p.m. at 5 o'clock in the morning when we start the next day.
So lots of people asked about just that. If I'm going to be on campus on the weekend and I want to go to the student center, do I need to fill out a screener? The answer is yes. And if I develop symptoms on the weekend and I submit a screener, will someone from Campus Health Center contact me? And the answer is yes.
Mm-hmm.
I want to, we're at 1 minute past. I want to thank Dr. Kilgore, Dr. Bankert, and Kelly Dormer for joining us today. It's always good to be able to answer the questions that we know people have circulating around campus. We encourage you again, if you have questions for members of the Campus Health Committee, to submit them to healthcommittee@wayne.edu. We'll reach out by email where we can, and we certainly are preparing to answer those questions in subsequent town halls. Thanks again, everyone. Hope your semester's off to a great start. Thanks for joining us.